Namaste. Let us quickly understand STYE. Another name for STYE is hordeolum. It is an acute suppurative inflammation of lash follicle and its associated glands, Z's and mole. Looking at the etiology, there are some predisposing factors. The predisposing factors are: first is the age. It is more common in children and young adults. Second is habitual rubbing of the eyes or fingering of the lids. Also, we can see recurrent STYEs in chronic blepharitis. The third is metabolic factors such as chronic debility, excessive intake of carbohydrates and alcohol. The causative organism most commonly is Staphylococcus aureus. According to the definition, it is an acute suppurative inflammation. That means the patient is going to present with acute pain and inflammation and suppurative. That means pus will be there. This is associated with swelling of the eyelid, as you can see in the figure. Also, there can be photophobia and mild watering or epiphora. In STYE, two stages can be seen. The first one is stage of cellulitis. Whenever you hear cellulitis, what can you imagine? You can imagine a firm structure. So here it is characterized by localized, firm, red, tender swelling at the lid margin, which is associated with edema. Usually there is one STYE, but occasionally there can be multiple STYEs. Then we have stage of abscess formation. In abscess formation, there will be visible pus point on the lid margin. That is why it's called suppurative. The first step in treatment, which is very useful, is hot compresses. We give hot compresses 2 to 3 times a day. Then we know that there is a pus point. So we do evacuation of the pus. And then a lash follicle is involved. So we epilate the involved lash. Later, we can do surgical incision. But we do this rarely if it is a large STYE. Otherwise, we can treat it by these methods. Next, we give antibiotic eye drops because it is a bacterial infection. We give it 3 to 4 times a day, and we can also give eye ointment. We give this at bedtime. Next, we can give systemic antibiotics. Next, we can give again systemic anti-inflammatory and analgesics. This is to reduce the pain. Then, in case of recurrent STYEs, we treat the underlying predisposing factors such as diabetes or chronic blepharitis or rubbing of the eye that the patient is doing. And we can decrease the intake of carbohydrates and alcohol. Thank you. In the next video, we will differentiate between STYE and chalazion.